Thanks everyone, and what an amazing couple of days it's been so far. I think a lot of what I'm going to be talking about today has been touched on in one form or another during the last couple of days, particularly some of the speakers who have talked about the importance of language and paradigm shifts in the way that we're sort of presenting the services that we provide to injured workers. And I really loved listening to Rosemary, who, I don't know how many of you were lucky enough to hear the last presentation in here, but she did talk about the detour. And I guess what I'm going to be talking about is our efforts at TNT over the last few years to make the detour from life, or from the normal pathway after injury, as short and as positive as it possibly can be. And so I'm going to talk a little bit about our journey that we've had. Not a lot of what I'm going to say is rocket science, but I'm going to just tell you the story of our journey and how it's gone for us, what's worked for us. It starts off in a bit of a dark place about 5 years ago, but it is a tale of redemption. It's getting better all the time, even though the journey continues. So 5 years ago, hopefully I'll find the right clicky thing here. Oh yeah, 5 years ago, TNT had a huge number of injuries and workers' compensation claims. So many of the licensees in the room will be aware of that. That's published, it's in the public domain. We had a really high incidence of workers' compensation claims. And we had a really high incidence of lost time injuries. So we had a lot of our workers who were not trusting of our preferred medical providers. So as many employers do, we have medical providers that we would recommend to our workforce, and they were not choosing to use them. They didn't trust them at all, and of course we were seeing a lot of lost time injuries, some of which we felt didn't really need to be lost time injuries, and we were feeling the negative benefits of that. And we were seeing a lot of conflict in this area, a lot of angry workers, a lot of angry managers, and a lot of distress and conflict. And of course, our rehab and injury management team were trying to secure good outcomes for workers in this sort of environment and finding it really, really difficult, finding it difficult to get anywhere. So we began to look at what might be going on. So at first glance, we noticed a few things. We were really bad at reporting injuries in a timely fashion. So we were often only getting reports of injuries once someone had lodged a workers' compensation claim, which I know is really shocking, and I'm confessing to you here, but we were really bad at it. Our system, our workers' comp system, required us to have an incident report number, and that's the stage at which we were most commonly reporting incidents, when the workers' comp team would say that they couldn't input the claim without a report. Oh, our line managers were really detached. So our line managers were overwhelmed. They didn't feel that they had any agency in this area. They didn't feel confident in this area. And as a result, they were really pulling back from it. And they were being quite negative about the whole injury environment. So that was a problem. There was a real focus in our language and our attitudes on time off and incapacity throughout the whole company. And we were seeing a real cultural enthusiasm for compensation as the primary remedy for injuries. So I'll talk more about how we were reinforcing that as we go on. So looking a little bit deeper at what was going on, the language that we were using, and there's been lots of talk about this over the last 2 days, was reinforcing this focus on compensation. So for example, the department that we worked in was called Workers' Compensation and Rehabilitation. We were really good at the workers' compensation part of it, and that's not to be under stress. Like, we were doing a great job in managing workers' compensation. It's just that perhaps we had got that balance a little bit wrong, and we were putting too much focus on the compensation and not enough on the rehab and more positive effects. We needed to work on our reporting, as is obvious. We needed to work on engaging our managers and improving their skill level in this area. And we needed to really address that anger and resentment that we were seeing. So then we looked outside our company at some ideas about what might be contributing. So we looked first of all at the Sherbrooke model, which many of you may be familiar. It's a model that sort of conceptualises ways of reducing chronicity with musculoskeletal injuries. TNT obviously is a logistics company. We move heavy things from one place to another. We have a lot of manual handling injuries. And that model, as many of you are aware, says that a focus on early return to work with workplace adjustments, rehab focused on regaining work capacity, with clear communication between the worker, the line manager and health practitioners is associated with good outcomes. And the whole idea of early intervention and workplace-centred, integrated case management after injuries is based on that model from the 80s. But then there's also the ecological case management model, which many of you would also be aware of. This was really interesting, and it said that an individual's response to injury, how they respond, so the injured worker's reaction and the coping skills that are sort of brought to the fore after injury, can be really impacted and are really impacted on the support that they receive from their community, first of all. And with workplace injuries, the community is the workplace. So the support that they receive from the workplace, along with their environment, so the support they receive from the community, and any legislative or systemic factors that are into play. So those things combined can really influence the individual's coping mechanisms and their attitude towards the whole process. So this was kind of really interesting as well. So that made us consider our actions and our inactions and how that might be having an impact on the culture and the characteristics that we were seeing in TNT. And out of all of that came what's now known as TNT Early Care. So initially it was known as, well, I'll talk about what it's known as in a minute, but I won't go through exactly what this involves. This is an early intervention program. Many of you will have your own versions of this. I'm happy to talk through exactly what we do a little bit later, but it's a standard early intervention program with a few particular characteristics that I think are very helpful for us in our environment. So first of all, we looked at the language we were using, and we started very consciously putting prevention first in all our communications, and then rehab and injury management, and then compensation. So turning that around from our first response, to oversimplify it, our first response when someone was injured previously was to give them claim forms, and we were really, really, really good at that. So we are still giving them claim forms if that's what's required, but that's not the first thing that we're concerned with. The first thing we're concerned with is trying to prevent injuries. The second thing, once someone is injured, is the early intervention, making sure they're all right. So that language, making sure, going through all our policies and procedures, removing that primary focus on compensation and inserting a primary focus on early care was the first step. It was even to the point where we did have an early intervention program running before TNT Early Care. It wasn't used very much. It wasn't very effective, partly because we weren't very good at reporting injuries, and so the opportunity wasn't there. But that was called the low-cost claims procedure. So a real focus on money and compensation again. So initially, it was a step change. That became the low-cost cases procedure to start with, and now it is TNT Early Care. So the language was really, really important, I think. It's initiated, TNT Early Care is initiated by the line manager. So there are lots of different ways of doing this, and this isn't easy, but this is the way that we do it in TNT. So the moment that a worker reports that they think that they have suffered an injury or illness to their line manager, TNT Early Care begins. And it's the line manager's responsibility to begin the process. And the process begins with interpersonal caring, essentially, with "Are you okay?" So we've moved from examples of managers going, "Tell it to someone who cares," basically, as a response, or "Here's a claim form," to right, I'm putting down my tools, I'm looking at you, what do you need, what can I do to help you? That's the first response. And the line managers, of course, have different levels of capacity in this area, even after our training and what have you that I'll talk about in a minute. And so there's support close to hand. So my team are close to hand and at the end of the phone. And even if, as Peter, who's here, will say, the line manager's response is to get them on the phone, that's fine. It's still expressing concern for that person straight away. So that's the first thing that they have to do. Reporting is, of course, very important, and we, by coincidence, at the same time as we were driving this, the company introduced a new and much more effective reporting system. So we have that in place now, and we have a requirement that injuries are reported as soon as possible within 1 working day, like most normal companies do. We did a lot of training. So we talked about this with our management teams. So our management teams go through regular training that's driven by the injury management team about managing injured workers and early intervention and their role in this process. But we also do a regular training session once every year with all of the workforce called What Happens When I'm Injured, or What Do I Do When I'm Injured, which talks through what they should expect. And it says you should expect that your line manager will be taking care of you and will be wanting to make sure that you're okay, and if necessary will arrange for medical assessment or may accompany you to that, all of those different things. This is what you can expect, and then our training with the managers make sure that that happens. So as I said, as soon as the injury is reported, the care begins, and it's not something that costs money. It's nothing to do with money or compensation. It's about that interpersonal caring. Then there's early contact from the injury management team. With the new reporting system, the injury management teams are immediately advised that a report has been lodged. And so the team have a KPI of making contact with the manager and the injured worker within 1 working day of receiving that report. And my team have just taken to this. This was completely new. And they've taken to it like ducks to water. They just love getting in quickly and responding really, really quickly. And workers' feedback that they find that just incredibly supportive, as I'll talk about in a minute, that they know that they're going to get a call. No matter what's happened, even if it's extremely minor, they're going to get a call for someone making sure they're okay and offering help and support and telling them what they can do, what they can expect, and what they can do if they have further difficulties. So that works very well. And this early support includes, but is by no means limited to medical treatment. So the focus can tend to be on we provide medical treatment through early care, which we do if that's required. There can be limited, simple medical treatment, but that's only a small proportion of it. It's, as I say, the interpersonal stuff that matters. It's making sure that the little problems are dealt with. It's reassuring that worker. It's providing modified duties, letting them know that all of that stuff is more important. And workers' compensation is still there in exactly the same way as it's always been. It's just not the first thing that we hand to our workers. So what have we seen? Well, there's still a long way to go, but statistically, obviously, we've seen more incidents reported. We're actually reporting them, so we're seeing more of them. So our incident reporting has got a lot better and it's maturing, so that's really great. The red bars are the early care bars, and they've gone from very little, about 4 or 5 years ago, up to quite substantial numbers. And the green line that's going down is the number of workers' compensation claims, which is fantastic. So the number of workers' compensation claims had started to reduce before we started this process through really great work by people over a period of years, but it's accelerated over the last 4 years, and we've seen a 60% reduction in workers' compensation claims in 5 years. And so you may think that that could be because we're whipping out all the really easy matters out of workers' comp. And if that were the case, then we would expect to see this bulk, this 40% of the original that we're left with now, being serious claims. And we're actually not seeing that. We've seen, interestingly, seen a reduction in the number of serious claims that we're seeing in our workers' compensation portfolio at the same time. So there's something else going on here that's influencing injury rates and the types of injuries and certainly the outcomes as well. So the statistics are looking great. We're also seeing high levels of maintenance at work. So we're seeing, without ever mentioning lost time injuries as part of this process. So there was nothing in the training or the way that was introduced that referred to prevention of lost time injuries. I was obviously a byproduct that we wanted to see. It was an indicator that things were going well. We've seen a massive reduction in the number of lost time injuries over the last 4 years, which is great. We're now seeing almost no conflict. So I've got some claims officers here who are probably going, oh, really? But it's a huge reduction on what it was before. So the amount of conflict in our environment has diminished to a really a normal level, what I'd say is a normal level. And we've got a happy-ish workforce, a much happier workforce than we did a few years ago. And we've been seeking feedback. So we didn't really do this before TNT Early Care, but we have for the last few years. We've sought feedback really primarily about the perceptions of the service and support that they're getting from their manager after injury. So a lot of the anger was focused on their manager, was letting them down, wasn't taking care of them. You know, they were sitting at home, they weren't getting any support, and they were furious. By the time we got to them saying, hey, want to come back to work? They go, forget it, and just didn't want to play with us. So we have sought feedback about their perceptions of their level of support from their manager, the perceptions of the service provided by the preferred medical provider and whether or not they chose to use them, and if not, why, if yes, did they like them, and the perception of the service provided by injury management. So we found that from the beginning, the workers were saying injury management associated with early intervention, fabulous. They just loved it. Managers, yeah, all right, not so much, but still a lot of anger to do with managers in the first couple of years. And that's improved dramatically. So now sometimes the workers are perceiving that their managers are the most helpful people in the whole process. And I think that's fantastic. You know, that's associated with really great outcomes. They feel really connected. They feel like their manager is there for them right from the beginning. And the vast majority of our workers initially are choosing to see the preferred medical providers now and think they're fantastic, really high quality, providing a professional, excellent service and giving them great advice, which is really super interesting because they're the same preferred medical providers providing essentially the same advice that they were 5 or 6 years ago when they couldn't stand them and felt that they weren't providing good advice and they didn't want to see them. So something's changed there. And we're asking them for qualitative comments in their feedback. And the words that our workers are choosing to use, and our workforce, sweeping generalisation, but a lot of our workforce aren't the most articulate people. Like that's not where their skills lie. They're not journalists and negotiators. They're the logistics people. They have other skills. But the words that they're choosing to describe their impressions of the service that's been provided are just amazing and exactly what we're looking for. So they're perceiving that TNT is super supportive. So the biggest words are the most frequent one. We're supportive, we're helpful, we're caring, we communicate really well, reassuring, immediate. There's all the sorts of things that we were hoping to achieve, they're telling us that they're getting that. So that just makes me so happy. Love it, absolutely love it. But the other interesting thing is that there's a couple of things there about no pressure. No pressure, professional, reassuring. And I read that as being about there's no undue pressure on people to return to work inappropriately. And this is, we're pretty much, when it comes to return to work and keeping people at work, we're doing what we've always been doing. You know, we're just doing it slightly differently. But it was perceived completely differently before. It was something that provoked conflict and made workers really angry, and they saw it as being a really negative thing. But now that the language has shifted and that we're taking a different approach, it's being perceived that there's no pressure. More of them are actually coming back to work, but there's no pressure. And that it's supportive and caring and timely. So it's really fantastic and very rewarding to get that sort of feedback for the team. So then why do we think this is happening? Well, I have a few theories. I think it's primarily because our immediate response now, instead of focusing on compensation, is to focus on care and support and to use that sort of language to start from there. And that makes a whole difference. That makes a big difference, and it sets the scene for a more positive journey. The workers really perceive that TNT is doing this for them in a way that they don't perceive that workers' compensation is something that TNT is doing for them. There's something about this approach that, by the way, does turn into workers' comp sometimes, and that's absolutely fine. Something about this approach that seems to make people feel happy and feel like they're well supported. So the expectations are set from the beginning, and that's one of the really important things, that our managers are talking to the workers in the injury management team as soon as they get in there, talking through how this can go, that we're there for them, that we're going to support them and see them through and get them better, and that makes a massive difference. And that maybe when someone's injured, we were giving them compensation, when really that wasn't primarily what they were looking for. Maybe what they were really looking for was the caring and the interpersonal support. And that when we responded simply with financial compensation, which is pretty much what workers' compensation is, it actually wasn't really what they were looking for. Now, don't get me wrong, I think workers' compensation is incredibly important, absolutely vital, and that it's really necessary for people who are injured and they have financial losses because of an injury, then that's a vital system to have in place. But on its own, it's not enough, and it can actually cause a lot of problems. Some of you may have some other ideas about why it's worked. So it's extending a hand, and that's made a big difference. And then we've also seen wider cultural change in TNT, some of which we can't take the glory for, but it's interesting that it's all happening around the same time. So we have seen this rapid paradigm shift in injury management over a 3 to 4 year period. There's been a really big shift in most areas, and sure, there are pockets of resistance and pockets where it's been challenging, but overall there's been a really big shift. And we're seeing our managers very proud of their role in this area now, in some areas, which is really great as well. Our injury rates are decreasing. So yes, we're trying really hard to manage prevention really well, but it's interesting. We are seeing reducing rates of injuries. And I wonder sometimes whether that's because both the managers and the workers are aware that if someone is injured, that has a really big impact on their day. The manager stops what they're doing, takes care of the worker. They think about it more. So both the manager and the worker are trying that little bit harder to work more safely, maybe, because they just don't want to have the inconvenience of having to down tools and take care of each other. Maybe that's a byproduct that's a real benefit. As I said, the line managers are really proud of the area. Caring is now a company value, so many of you may be aware that TNT was purchased by FedEx about 2 years ago, and over the last few months FedEx and TNT have worked together to establish 4 core values, the first of which is caring. So we won't take credit for that, but it sits really, really nicely beside what we're doing. And the company also now has the space to have a broader focus on health and wellbeing, which was an area that we're just sort of starting to dip our toe into. For this turnaround, it's something that's been done before, but we're having another go now. So that's really great as well. So that's probably about it.
Wonderful. Thank you, Nea. Please join me in thanking Nea.